My name is Albina Abdullayeva, and today I will talk about EEG assessment of disparity-driven brain activity. Since the world around us is three-dimensional, our ability to perceive depth and judge distance of the objects surrounding us is an important task. The process of depth perception highly relies on different depth cues, and one of such depth cues is binocular disparity, which plays an essential role in binocular vision. Binocular disparity is a process when each eye sees slightly different image due to lateral separation of the eyes. This visual cue allows our brain to obtain information from two-dimensional retinal images and fuse them into a single 3D image. Near objects, the ones that are represented as cross disparity, usually attract humans' attention automatically. However, when it comes to objects located further away, the same cannot be stated. And from here arises a question: would this be reflected in our brain activity? The activity of the brain, one of the ways to evaluate is using electroencephalography. It's a common method that is used in many research fields due to its accessibility, portability, and easy handling. EEG allows directly to record brain's electric activity using electrodes that are placed directly to the scalp. Previous studies mainly focus on researching the cortical areas that are responsible for disparity processing, and they have concluded that the main cortical areas that were active during the process of binocular disparity were occipital and parietal lobes. Studies have also concluded that information about binocular disparity is present during early stages of visual processing. However, very little attention was paid to elucidating difference in EEG components depending on the type of disparity that is being presented. In order to research the effect of the different types of disparities on the EEG components, in current study, 10 subjects were recruited in age range of 20 to 30 years old. Vision examinations were performed in advance, and the main inclusive criteria consisted of the fact that the participants would have no binocular dysfunctions. Visual acuity, which was evaluated using Snellen's chart, had to correspond to normal or corrected to normal visual acuity, which consisted of 1 decimal or better. Stereo acuity was evaluated using Titmus test and had to be 20 arc seconds or better. Also, participants had to have standard color vision based on Ishara test. The stimulus that was presented to the participants consisted of 4 circles located in an audible paradigm. Each try was presented after a cross appeared in the center of the screen for 1 second. The experiment overall consisted of 2 tasks, and each task contained 300 trials, out of which 57 were target present and 243 were target absent. The experiment consisted of 2 sessions that were shown on a flat panel display. The order of the sessions would alternate, and in first session, the target present would be cross disparity, while in the second session, it would be uncross disparity, and it would alternate for each participant. The EEG components that consist of event-related potential and continuous waves were evaluated using EEG system Nicolet. Before starting the experiment, the participant was comfortably sat at 90 centimeters from the flat panel display. 21 electrodes, according to the International 1020 system, were placed directly to the scalp, while considering the impedance that required to be lower than 10 kΩ. Red cyan filtered glasses, which allow to separate the images projected into each eye, were required to be worn by the participants during test performance, while the cyan filter was located on the right eye. In case if the participant had correction, the stereo glasses were placed above the spectacles or contact lenses. The experiment was performed in dim conditions, which is required during viewing of anaglyph images. The participants had to complete 2 sets of tasks where the stimulus was presented on the screen and the subject had to identify which one of the circles is close or further from them and respond by pressing one of the corresponding keys on the keyboard. While the participants were performing the tasks, the EEG system recorded the brain activity. Overall, the time required for a participant to complete both of the tasks was approximately 20 minutes. Talking about the results, looking at the results of event-related potential, it was seen that there is no statistically significant difference in 3 time frames based on the type of disparity that was presented. In 70 to 150 milliseconds post-stimulus, as it was expected based on the theory of early components, the activity was mainly based in posterior part of the brain. In time frame of 150 to 250 milliseconds post-stimulus, it did show slight higher activity in uncrossed disparity when looking at the topographic map. In time frame of 250 to 400 milliseconds post-stimulus, the activity was same for both disparities and located mostly in the posterior part of the brain. When it comes to the results of continuous waves, there was also not found any statistically significant difference in neither of the waves. However, the topographic map does show slight reduction in alpha wave during uncrossed disparity. Based on the results that we obtained, it can be concluded that there is no significant difference in EEG components based on the type of disparity that is presented to the subject. Event-related potential components showed that crossed and uncrossed disparity is perceived in a similar manner, which was also confirmed by the results obtained by brain oscillations. However, the slight activity that was seen in event-related potential component in time frame of 150 to 250 milliseconds and the reduction in alpha wave could be related to the high demand in attention in order to perceive the uncrossed disparity. Thank you for your attention.